The day of surgery experience usually actually begins the day before surgery, because the day before surgery is when they're preparing for their surgery. They will receive a phone call, usually from the hospital, advising them of their time that they need to come to the hospital. They'll go through the list of medications perhaps that they're taking, making sure that anything that needs to be stopped is stopped. They know about their fasting times, from what time they need to fast for their procedure if they're having a general anesthetic. And they know about the logistics, or where they need to go, where they need to park, who can drive them, can they drive home after surgery, who is going to pick them up. All of these things are covered, in fact, that day before surgery from the hospital, but also covered by my staff at the time of booking and thereafter, and actually patients are taken through this a number of times. On the day of surgery itself, when the patient comes to hospital, usually somebody will bring them here, a friend or family, simply because patients don't really want to leave their cars lying around, particularly if they're in hospital for more than a day and they can't drive after surgery. So usually somebody will come with them, bring them to the hospital. They'll go through the admission process where all the paperwork is checked. They'll get changed into their gowns. They'll go through another checklist with our nursing staff to make sure that it's the right patient, right body part. We have all the equipment, that no mistakes are made. But then they'll usually meet my anaesthetist, who will go through with them with the anesthetic side of things, discuss all the risks. Usually the anaesthetist will actually speak to them the day before surgery, or sometimes early if there are medical indications, but when they actually get to meet the person face to face on the day of surgery. And then finally, they'll see me once again, and that may be because we need to mark up the patient and do some artistic drawings on their chest or their abdomen in preparation for surgery, or we'll just say hello and have a discussion, ask for any questions before they go off to sleep. Then they get wheeled into the theatre and have some glass of champagne, as my anaesthetist would say, and then they go off to sleep. It's up to us to take care of them, to make sure that they're safe, they're asleep, there's no issues. That's what the anaesthetist does through the whole procedure, making sure that all their important parameters are well looked after, and that there are no issues, whilst I'm focusing on the actual surgical procedure and on what needs to be done. And then thereafter, the patient has had a dressings done. They wake up usually as they're coming out of theatre, and they're wheeled into recovery, where they stay for about an hour on average. Then they go on to either day surgery or go to the ward, depending on what kind of procedure they're having. And then the experience from there varies a little bit depending on how long they need to stay or not stay in hospital. But essentially, following this, we also have, of course, a follow-up that is arranged with myself and my team. And throughout the time the patient doesn't see us, they have our contact details, and if there are any concerns at all, they're on their phone or their email, take photographs of any concerning area or issue, email us. I usually respond to them within 5 to 10 minutes, as I check the email frequently to make sure that I'm available and I answer questions quickly and thoroughly. Then we'll catch up for our post-operative follow-up. That's usually around about 3 weeks post-operative period, and we usually have 3 follow-up appointments. We'll see patients at 3 weeks, then at 6 weeks, and then about 3 to 6 months, depending on the procedure. It gives us ample opportunity to monitor patients' progress, ask questions, and to make sure that there are no issues in the post-operative period. And of course, as necessary, then we'll see patients further down the track if it's a necessity for this procedure.